The key focus of today's webinar is technology and mental health, as you've seen, the issues today. And joining me, we have renowned academics and clinical expert speakers. So this webinar is a joint event between, as you can see here, the UK Centre for Internet Safety Evidence Group, the Department of Digital, Culture, Media and Sport, and eNurture. I'm Dr. Elena Martellozzo. I'm a criminologist from Middlesex University, and as a UCAS representative, I'm here to chair this event. So just allow me to explain what we do as a UCAS evidence group. We provide UK Centre for Internet Safety with current, critical and rigorous account of relevant research. The group is formed of representatives from academia, government, NGOs and industry. And we meet regularly in order to identify, evaluate, and we also commission new research relevant to child internet safety. So before I start, we thought to make this a little bit interactive, and I'd like to ask the audience one question. So let me share the next slide with you. This is the question to you. So if you could change one aspect of the digital world, what would you change? Now, I'm aware that this is a challenging question, so please do take your time. You can answer in this way. You can grab your phone or take any device and go to www.slido.do. And the code that you need for this is online harms. What we'll do is we'll review your answers halfway through the webinar. So it's www.sli.do, online harms. Now, a little bit of housekeeping. You've noticed that there's a question and A facility, so please feel free to type your questions throughout the event. Myself and the moderators will be monitoring the chat throughout and ask the speakers later to answer some of the questions. We won't be able to answer them all, obviously, but we'll do a selection. Now, as one of the organizers of this event, I'm aware that amongst the audience, we have practitioners, we have teachers, and we have many parents. I do hope that you find the debate insightful and that you'll be able to take home some key helpful messages. Now, at this stage, I'd like to introduce you to our first speaker to officially open the event. That's Professor Sonia Livingstone from the London School of Economics and Political Science. She wears many hats, as always. She's a member of the UCAS Evidence Group and eNurture Deputy Director. Sonia, the floor is yours.
Brilliant. Thank you very much, Elena. And it's a pleasure to be here and to see everybody, in what I hope is going to be a really exciting event. So I was reflecting in preparing for this event that when my colleagues and I began the evidence group for what was then the UK Council for Child Internet Safety 10 years ago, we were already keen to differentiate among children and young people, concerned that they were too often lumped together by media and policymakers as one kind of homogenous group. And we really wanted to recognise from the start the inequalities and differences among them. So we wrote an early paper on the digital pathways of vulnerable young people. And we puzzled, given a lack of evidence, over whether their outcomes were worse than those of more resilient young people because of their starting points in the offline world or because of what happened to them when they were online. In short, we've kind of spent quite a while trying to think about vulnerability in a digital world and working out, when should we focus on young people's lives offline and their kind of contexts of life, and when should we focus on the particular and perhaps different pathways that they travel online. Of course, 10 years on, we'd agree both of these are important, all of it's important. And we'd also, I think, argue that that online-offline distinction is becoming harder and harder to draw, though I wouldn't go so far as to say it makes no difference. And I'd not say it makes no difference, partly because the last decade has seen a really startling level of technological innovation. So it's really important to understand that, in which we've moved, I suggest, from seeing technology as a kind of valued addition to our lives to seeing technology as its vital infrastructure. And as COVID-19 has made that really clear now, for young people especially, life is digital by default. So while UKIS's focus has always been on digital innovation, regulation and policy in this effort to, I quote, make the UK the safest place to be online, that's its strapline, I think it has found it harder to grapple with the challenge of understanding mental health and to understand the implications of the digital world for the specific needs of young people who are vulnerable in often very different ways. But of course, UKIS has to meet this challenge because, as we all know, just before we were all obsessed by COVID, I think we were really paying a lot of attention to what was called the mental health crisis facing this country. A crisis, both it's been claimed in the level of suffering and in society's capacity to respond appropriately. And also in the kind of public mind and the media coverage, this mental health crisis has been often linked to the supposed twin evils of screen time and social media. All of my claims now are kind of up for contestation during this afternoon. I think there are just a host of research questions as well as questions of policy and practice about the definition, measurement and scale of the problem, and about the causes, consequences and solutions. And no one here, I think, is expecting clear-cut answers. What's been interesting for me is I think this situation has brought UKIS increasingly into dialogue with the speakers who are at today's webinar and with those involved in the eNurture network. So the eNurture network is a UKRI funded programme that's co-sponsoring this event, and it's funding startup research projects and practical interventions designed to examine how the digital world is changing the conditions within which young people engage with family, school and peers, and really to kind of focus in on what these changes mean for children's mental health. And it's also developing and piloting interventions that might improve their outcomes, including interventions that really harness positive applications of digital technologies. So in my work, I've found myself spending more and more time with mental health practitioners, and it seems to me that on the one hand, mental health is a relatively kind of new challenge for those who have a lot of expertise in relation to digital technologies and the regulation and management of digital technologies. But the nature of that digital environment, I suggest conversely, is still rather new for those who are long experienced in the mental health difficulties of young people. So my sense is that today's audience includes at least two groups of people: those knowledgeable about digital technologies, but for whom mental health is a bit of an unknown and still a sort of a catch-all category, not much disaggregated. And it includes those who are knowledgeable about mental health, for whom digital technologies are still something of a kind of feared and little investigated black box. So my hope is that everyone has something to offer and something to learn, provided we all listen to each other and talk to each other, and I look forward to how this proceeds. So thank you very much, and over to our next part of the event. And Elena, if you're, I think you're, yeah.
Yes. Thank you. Thank you very much, Sonia, for your welcome address. Yes, now over to the next speaker. So it's a great honor for me to introduce you to Rachel Bishop, the Deputy Director of Online Harms Policy at the Department for Digital Culture, Media and Sport. Over to you, Rachel.
Thank you so much, Elena. And I want to say, firstly, a massive thank you and well done to you for all your hard work in organising today's webinar, and to thank the speakers too for their time today. I think it's going to be a really fantastic event. And it's great to see that we've got so many people registered today. As Sonia said, stakeholders from across academia, civil society, tech companies, and also international colleagues and parents. So I think it's going to be a really good discussion. Excitingly, it's also UKIS's first online harms webinar, which marks an important milestone for UKIS. As many of you already know, UKIS supports the government's ambition of making the UK the safest place in the world to be online. And the both UKIS and the Evidence Working Group have produced some really fantastic research and guidance to help us to deliver this aim. The Evidence Working Group produced the Adult Online Harms Rapid Evidence Assessment, which was one of the first studies which focused on adult online harms such as hate, harassment and abuse online to understand its prevalence and impact. And this groundbreaking research, combined with the group's commitment to sharing best practice and other research, continues to support and further our online harms evidence base. I wanted to speak very briefly about the government's commitment to tackling online harms. Being online can be a hugely positive experience for adults, children and young people. However, it also presents a risk of harm, and there is growing concern about the relationship between technology and the mental health of children and young people, as Sonia has already touched on. The pandemic has brought this into sharp focus, with children's screen time averaging 9 hours per day during the height of lockdown, which is nearly double the average prior to COVID. And a study by Ofcom has found that during lockdown, children were lacking structure and routine and were instead spending a large amount of time online, often unsupervised. While screen-based online platforms can enhance learning, support social networks, and reduce feelings of loneliness, they can also impact mood, self-esteem, and body image as a result of extended or prolonged time engaged with screens. Evidence in this space is still emerging, but it is important that we continue supporting research in this area to inform future action and ensure that high-quality advice is available to parents and families. And events like this are so important in moving the conversation forward. So thank you again for all of your time. I'll talk briefly about the wider efforts that government is making towards ensuring that the internet remains a safe and inclusive space for all users. Our plans for online harms legislation will ensure companies are more responsible for their users' safety online, especially children. And we will publish the full government response to the online harms white paper by the end of the year, with legislation ready next year. And the legislation will also be accompanied by non-legislative initiatives, including a media literacy strategy and a safety by design framework, which I hope will really help to support the links between positive mental health and the use of technology. Our online harms work, our commitment to protecting children online, will ensure that technology continues to have a positive impact for all users. However, we can't do this alone, and tackling online harms requires a whole-scale approach from government, industry, and academia. I'm looking forward to hearing from the speakers today, to hear their research and experiences, and understand how we can continue working together to reduce the risk of online harms. And I'll hand back to Elena, who will open the first panel session.
Thank you, Rachel. Yeah, now it's my pleasure to introduce you to our first panel. Which will be moderated to my colleague, Dr. Richard Graham, who's helped me hugely to organise this. He's a consultant child and adolescent psychiatrist at Good Thinking. Over to you, Richard.
Right, thanks, Elena. Right, just checking that I hadn't left it on mute, which is typical. Right, yes, well, let's get cracking because there's a lot to get through and time is short. Two fantastic presenters coming from the world, not just of research and data, but actually service delivery, because a lot of the research, I guess, that we often draw upon is coming from areas where it might be difficult to talk to the vulnerable groups that we so need to be talking to. So first up is Dr. Bernadka Dubicka, that many of you will know is chair of the Royal College of Psychiatrists Child and Adolescent Faculty. She's got a long research record as well as experience in terms of practice. And I don't think I'll say any more, Bernadka. We work a lot together on these issues. It'd be great to hear where your thinking is at this time.
Thanks very much, Richard, and thanks for inviting me. So I'll move on quickly. I can't move on. The first technical glitch, Richard. I shall stop sharing and try again.
Yeah, well, I think these events are the very definition of techno stress, aren't they? Where the technology is there to help us, and yet is not very faithful.
There we go. Right, we're starting. So first of all, before I talk about technology, I just wanted to say something about the crisis in child and adolescent mental health problems from my perspective as a child psychiatrist. So the first slide here shows you our recent prevalence survey, the first one in 15 years, which was completed in 2017. And as you can see here on the left, emotional problems have been increasing in both boys and girls over the past 15 years. But one of the shock findings was that more than half of older teenage girls with a mental health disorder were self-harming or attempted suicide. And that very much reflects the clinical experience on the ground in CAM services and A&E departments all around the country. However, that was from 2017. And over the past few years, there's evidence that might have increased even further. And here we can see a recent follow-up published last month, published in October, which shows that the prevalence of mental health problems in children and young people has actually gone up from 1 in 9 since 2017 to 1 in 6. So we have a real crisis of mental health problems, and obviously we have a duty to try and understand why this has happened. The reasons are probably complex, because we have to do something to try and prevent this huge onslaught. So of course we get asked all the time, what is the role of digital technology? And it's not simple, it's not straightforward. We will be talking about the many benefits of digital technology, and we've mentioned the pandemic just recently. And of course, the NHS has revolutionised the delivery of services during the pandemic. And I just want to highlight again how this issue is complex. So remote technology doesn't work for all children and families. It works brilliantly for some. It's enabled us to reach out, as we'll hear in a minute as well. But for others, it's really difficult. So for example, many autistic children find it really difficult to be seen remotely, much prefer to come in person. And for clinicians, a recent survey has highlighted the fact it can be very difficult to assess risk remotely as well, with these very complex children and young people that we see. So again, it's complicated. There isn't one size fits all, and it affects different people in different ways. So that complexity of interactions needs to be understood much better, as Sonia's indicated, with our vulnerable children, young people, where those potential harms might lie. So it's about which vulnerable children are using online technology, in what way, what are they doing on there, where are they doing this in the early hours, no supervision, and how they're interacting, and what content they're accessing. And again, in this prevalence survey, for the first time, questions were asked about social media. And there's dark blue columns there. You can see a highest in those children, young people who have a mental health disorder. In other words, they were more profoundly affected by comparisons on social media, by likes, comments, shares, etc. But of course, correlation does not mean causation. Here is another study. This is our national suicide study in children, young people. And as you can see from the column there on the left, teenagers appear to be more profoundly affected by suicide-related internet use. However, this is a hugely contentious topic. There's lots of debate about what extent social media and digital technology play in terms of children's mental health problems. This is one of many studies that you'll find that looks at the influence of social media technology. This is screen time, in fact, in this particular study, on the well-being of children, young people at a population level. However, as a clinician, I'm much more interested in what is the impact of different types of technology and the way that's being used by different groups of vulnerable young people, which studies like this can't answer. The WHO has taken a much more precautionary approach to the use of screen time in very young children. And as you can see here, they have looked at emerging evidence in longitudinal studies, looking at the effects on memory, reading and psychological problems. Their advice is that screen time should be minimised for very young children, and that the potential benefits of reducing screen time outweighs any possible harms and might in fact increase health equity. So against this background, we were constantly being asked to comment at the Royal College of Psychiatrists about what the impact might be. So we undertook a review, which was published earlier this year. It's freely available on our website if people want to take a look. And very briefly, in conclusion, there has been very minimal research on these most vulnerable groups. However, there is emerging evidence, and for that reason, we believe that a precautionary approach should be used. And we're also asking clinicians to ask about children's online lives. If you don't ask, you don't know. And I can give many examples in recent months, few years, when I've asked young children, for example, who are self-harming about their online lives. Some have reported having multiple social media accounts. They're using them late at night unsupervised. They're being really affected by cyberbullying or content they're finding. and many examples such as those. But again, if we don't ask, that we don't know. And as Sonia said, it's really, this is part of children's lives, and we do need to be inquiring about it, particularly the most vulnerable children. We very much support the government's initiative around regulation. However, we do hope that the regulator will have powers to enforce. And most importantly, as was previously said, this isn't just about one approach to managing this. We need to be looking at a whole systems approach, including the responsibility of tech companies. And we do need them to play their part, not only in research, sharing independent data, however that needs to be done in an ethical framework, but also contributing financially. I don't really have time to talk about the lines of evidence we looked at, but I'd just like to draw your attention to this review paper by my colleague at the University of Manchester, Joseph Firth, who has reviewed how the internet might be changing our cognition, shaping our behaviour and shaping children's brains, looking, for example, at media multitasking, the effects on attention and memory, excessive internet use, and the effects of mass acceptance, rejection, social comparisons on self-esteem in children, young people at vulnerable times in their developmental trajectories. And a recent review of that is in the journal I've put at the bottom there, that also talks about how little we know about the current social constructs around social interactions online, which are very different to the sorts of social constructs that we used to use in research. And this is an example of a paper that we looked at, which does try and look at the nuances of this sorts of interactions. So when they looked at and reviewed self-harm and suicidal behaviour, what they found was it's those young people who are using a lot, who have high levels of internet use, who are most affected by this sort of content. And they talk about the potential harms in terms of normalising the sorts of behaviour, the triggering effect it can have, the competition between young people, and the so-called contagion effects. And I mention that because that is something that many clinicians will identify with, and then they see that. For example, I worked in an inpatient unit for 11 years. Many young people would come into units with minimal self-harm, minimal eating dysregulation, but within not only weeks, but days sometimes, they would be profoundly affected by what's going on with other young people, and that competition, that contagion, that normalisation just becomes all too common. And we're potentially seeing this on a mass scale now. However, of course, there's huge potential to exploit the benefits in these vulnerable groups, as I've outlined here, and we'll hear about again in a minute. So there's a lot of disagreement about how technology might be impacting on the mental health of young people, but there is some agreement in some areas. So I think we've come to the stage where we agree that screen time alone is not a particularly helpful construct, and there's a huge variability in how children and young people use technology. Online risks often do mirror offline vulnerabilities, and at present the level of evidence we have just isn't good enough, particularly in the vulnerable groups. So we do need much more nuanced research at different developmental stages in different vulnerable groups, and we need to learn how to harness the benefits and support the most vulnerable and not exploit those vulnerabilities, for example with pernicious algorithms such as we see for self-harm and suicide. So finally, yes, of course we need better research. The question though for policymakers is how long do vulnerable children wait? And as a clinician who deals with safeguarding on a daily basis, we do believe, and as a college we believe, we need that parity of protection online as well as offline. Thank you very much for listening. If people are interested in mental health difficulties, please look at minded.org.uk, which is a freely available Royal College of Psychiatrists website. Thank you.
Thank you, Bernadka. That's a fantastic overview, full of balance and insights, but also, as you say, coming from the world of practitioners who are dealing with the impact of these harms on the young people and their families. But you do very helpfully highlight the value of using technology also to offer support. And so for our next speaker, it's my great pleasure to introduce Victoria Hornby, who is the Chief Executive of Mental Health Innovations. And prior to this, Victoria, you were the Programme Director for the Royal Foundation, leading on many programs, including the very well-known Heads Together Mental Health Coalition. So you're going to be talking to us about Shout, the innovative crisis text helpline, on the sort of insights you get when you offer people anonymous support that they can access through just SMS text messaging. So looking forward to this.
Thanks very much, Richard. I'm going to try and attempt here to share my screen. Okay. Let me just go back here to the beginning. So Thanks very much, Richard. So I'm Victoria Hornby, and we run a service called Shout, which is a 24/7 text-based messaging service. Since we started the text service in May 2018, we've had 500,000 conversations now with over 200,000 texters. And we're currently operating at around 1,000 conversations a day, and we have over 2,000 active volunteers who help us in the sort of front line of taking those conversations. The most common issues which we deal with on the service are suicide, depression and sadness, anxiety and stress, relationships, loneliness and self-harm. And we are a service which skews much younger, so about 70% of our texters are under 25, and as you can see here, 7% are under 13, and 29% are 14 to 17. And because we can, so our texters, very kindly, about 15% of them fill in a post-conversation survey. And so we're able to understand the different issues for different groups. So interestingly, suicide tends to be constant across all age groups, somewhere between 30 to 38%. Our younger texters who are 13 or under are most likely to discuss the suicide as one issue, but also issues around self-harm and bullying. And then other groups will discuss different issues. What we see is that things like anxiety and stress increase over age groups, as do depression and sadness. And issues such as self-harm and bullying decrease, so highest in the 13 group and drop down as you get older. So of those 1,000 conversations we take every day, 45% of those texters are new to the service every day. And we've done a bit of work in understanding where those texters come to us from. So of those first-time texters who are under 18, 21% of them found us using Google, 13% through social media platforms. And again, in that under 13 age group, very interestingly, 33% of our first-time texters came to us through TikTok. So it's very interesting. We can also see, which I can show you a bit later, how the different platforms interact with each other, and also how different age groups use different platforms. The interesting thing for us, I think, is that intersection between mental health, social media, the online world, and news. News is a big thing for us, and you can see here in this slide, so this is our sort of daily activity, and these big spikes you see here are all the result of social media shares and around news events. So you can see that first one, which was in December 2019, that was just somebody posting our number on Facebook, which had a huge impact, unfortunately for us over Christmas, but it was good to be there for people. And then there are others of very significant growth and activity around the death of Caroline Flack, and that was very much driven by Instagram. And then earlier this year, the death of a gamer called Byron Bernstein also died by suicide, and that created a massive swell of use of our platform by young TikTok users. And one of the things that's interesting for us about how these things happen is that often something like a death by suicide, or indeed lockdown, which you can see there, the second lockdown announcement, there's an item in the news, and that news generates some anxiety, stress, worry amongst people, and so they start sharing support services. And what's interesting about that, I think, is that these are, in this case, particularly young people who are looking at their devices, they're online, and they see content coming to them about whether it's about suicide or poor mental health or anxiety or stress or worry, and that generates worry in them, we think, which then leads them to feel that they need very urgent help and support. And so with these with these large shares that you see here, these large spikes in activity, our understanding of those is that this is really driving people to talk about their mental health. What we don't know is whether that is need that was always there and is suddenly finding an outlet with our number being shared and people realizing that they can reach out for that help, or whether in fact it's generating a level of anxiety which is creating a sense of crisis in itself, which is a really interesting question for us in the longer term. So just to talk a little bit about how these work. So that last spike which you saw, which was about a month ago, which was on the announcement of the second lockdown. And you can see on the left here that our conversation numbers begin to grow quite significantly over a number of days, and that is represented almost exactly on the right-hand chart with the shares and the way that the social media platforms kind of generate waves of activity in themselves. So you can see there are some early shares on Twitter, which are then picked up on Facebook, and there's a second spike there which correlates with our conversations on the left-hand side. And then you can see that it really begins to pick up pace on Instagram and lasts for a while. And so the peak on Instagram matches exactly the peak on our service. And that's also quite an interesting thing for us, is the way that this activity online drives an immediate increase in the need for our service. So within minutes, really. So for example, with the death of Caroline Flack, that was announced on the news, and within 15 minutes, we were beginning to see a significant increase in volume and activity on our platform. So there's something there's the instant response, and then there's the kind of wave that follows on from that, which is quite interesting. And then another little piece about which I just wanted to pick up on, because I think it was mentioned beforehand, and I think it is really important, this thing about late nights and content, and how content is being consumed, particularly by children and young people at different times of the day. So you can see here that the busiest time of day for us in September, so when young people are at school, is slightly earlier in the day, so it's 10 o'clock, and in the holidays you can see that it moves at least an hour later. But you can also see that big peak in activity, which begins at around 8 p.m. and drives forward for our service through to about 2 a.m. And that for us is very much a signal that there are young people who are searching for, looking for, or consuming content late at night. And from the conversations we have on the platform, that is pretty much unsupervised. And so we have lots of young people contacting us, wanting help and support at that time of the day, right up till 4 in the morning. And they're on their devices and they're on their screens, and they will tell us. So 55% of young people who contact us tell us that they have no one to talk to, and that's partly a physical no one to talk to, but also an emotional no one to talk to, which is a worrying fact in itself. So I hope that's a useful or interesting way of looking at the way that we see social media and the online world impacting on and affecting the need for our service.
That's fantastic, Victoria. There are so many things that one would want to talk about, but again, that sort of interface with the technology being supportive and it being a place where you can turn to for support when perhaps adults in your life, trusted adults, may be preoccupied and worried themselves, not wanting to burden them. Anyway, yeah, just so much I could talk about, as people know I can. But let's just quickly, because we're so pressed for time, there's some really good questions coming through. Bernadka, just to go back to you, one thing you could change about the digital world quickly, what would you, chair of an important faculty of the Royal College, choose?
It's a really big blue sky thinking one, and probably very idealized, but I'd love to see the same sort of global togetherness on technology, the regulation and safety and responsibility from the tech companies, as we've seen for climate change.
Right, well, thank you. Interesting one. Victoria, you may have given us a hint already to one of the things you might be changing, but where would you focus given all the insights that Shouter are collecting?
I think we have to have much clearer signposting of safe sources of help. I think, you know, we have young people who regularly contact us saying, you know, I did an online quiz to see if I have depression or an eating disorder, or and just the random searching with the completely unfiltered content that comes with that. We see that as very damaging for children. Yeah.
And I think you've also indicated, as we're picking up, TikTok itself is kind of taking over as the health information resource for many young people. We've got perhaps just time for one question on, I think, Elena, we didn't say this, but we're going to save the questions and hopefully the presenters will be able to answer some of them after the webinar that we can then feed back. But an interesting one about training the child and adolescent psychology, psychiatry workforce. Sonia's touched on this. How digitally literate is the children's workforce in terms of the public sector? And what are the opportunities and potentially the obstacles when services are besieged pre-COVID? No pressure, Bernadka or Victoria, but it's...
Well, yeah, I mean, that's a really, really important question, and I think you probably agree that no, we're not particularly digitally literate, and certainly not as much as the children and young people that we see. So it is a huge challenge. But I think the first step is just making people aware that these are issues they should be asking about and talking about. You know, finding out, you know, how young people are finding being online helpful, because a lot do. And you know, that's when I ask people, often that's a response I get as well. But similarly, if there are concerning things happening online, if you ask, you can discuss, and then you can think about how to put steps in to try and support those young people.
Yeah, yeah. Well, Victoria, you're training volunteers very regularly just to keep up with the demand. Digital media literacy, is that part of your thinking at this time?
Yes, absolutely. And I think really understanding how people consume news, content, all that, it is so important. And I think the way that things are reported, there's a comment in the chat actually, which is quite right, which is the responsibility of how things are reported. So we can see from our service that someone who is well known, for example, ending their life, can have a huge impact. And so responsibility in how that is reported, and also enabling people to talk freely and openly about how those things impact them is really important, because there's the event itself, and then there is the way in which it's perceived, reported, discussed. And as we all know from the way people comment online, it's often in a really unfiltered way and in an unconsidered way, and that has disproportionate effect on children. So you may not feel that you're on a social media site or are followed by people that are young, but actually your comments get out there. So whether you're the Daily Mail reporting on Caroline Flack's death, or as happened to us, you know, someone on TikTok talking about the suicide of a gamer, that content is consumed in so many different ways, and we need to be open and in discussing how that content is perceived.
And can I just add, of course, there's the 13 Reasons Why evidence, which showed that over in the States, a month with that, when that was showing that youth suicide went up, and because young people were digesting that information. So it's sort of direct evidence of the impact on actual suicides.
Yeah.
So interesting that in health, media literacy may be one of the things we need to be focusing more on. We could go on, but there are so many great speakers still to come. We're going to have to pause there. So thank you both enormously. And if anybody hasn't taken down, Victoria, the number for Shout that they might want to share with all sorts of vulnerable young people, or older people for that matter, or as I've said to you before, people in Downing Street, that we'll have to leave it there, but there's much more to be said. And I think, Elena, we're going to now have a quick catch up with Slido and see what some of the attendees are thinking about in terms of what they'd like to change.
Yes, we are. Thank you, Richard. And yes, if you want to follow Shout, I shared all the bios yesterday with the tweet. So do tweet away and follow up the wonderful things they do. So let's take a look at some of your responses here. Let's see if there was one thing that you would change, what would that be? At the top there with the big characters, we've got security, safety, moral responsibility, social behavior, corporate responsibility, that's a good one as well. What else? The respect of the users, equality, fact checking, yeah, I'm with you on that. Verification, anonymity, speed of change. What else do we have here? Tracing. But we can see that the top, I'd say probably 2, 4, 6, 7 are around security, safety, social responsibility, privacy, and social behavior. Thank you all. We're going to ask the same question a little bit later, just to see if our speakers have influenced your responses. So I'd say that we move on to our next panel. And I'm going to hand over to my colleague, Dr. Daria Kuss, Associate Professor in Psychology at Nottingham Trent University, who is going to moderate and introduce the next panel and speakers. Thank you, Daria.
Thank you so much, Elena. Thank you, everybody, for being here. I'm really pleased that I'm now going to introduce to you one of our great speakers for the second panel. This speaker is Professor Henrietta Bowden-Jones. Henrietta is a medical doctor and neuroscience researcher, and she's working as a consultant psychiatrist in addictions, and she leads 2 national clinics in the UK. Now, on the one hand, she's the founder and director of the National Problem Gambling Clinic, the first NHS treatment centre in the UK for problematic gambling, and very recently also opened the National Centre for Gaming Disorders, the first and only NHS clinic in the UK treating gaming disorder, which is fascinating, and she's going to be talking to us about this specifically today. She's also the recipient of many national and international prizes for her research, and she's the founder and joint chair of the National UK Research Network for Behavioural Addictions based at Cambridge University, and the executive board member of the International Society of Addiction Medicine and the International Society for the Study of Addictions, plus a number of other roles. And if I was to mention them all, Henrietta, I'm afraid we would be running out of time. So we're really, really pleased to have you with us today. And you'll be talking about the first year at the National Centre for Gaming Disorders today, an overview. I'll pass on to you.
Daria, thank you so much. It's such a pleasure to be here with you all. My talk will be very informal. I wanted to take the opportunity and share with you very much from a personal perspective, but with some statistics, how the first year at the National Centre for Gaming Disorders has gone, the things that we were expecting and the things that we weren't. So the first thing to tell you is that after 12 years of running the National Problem Gambling Clinic, NHS England, in their 10-year plan in 2019, added this gaming clinic, fully understanding the complexities of the crossover at times of gaming and gambling. They were particularly worried about loot boxes. I think that's what got us to get a look in terms of a small pot of funding. So we were really only commissioned to see 50 people a year. And the most important thing I felt as the leader of that clinic was that I wasn't going to sensationalize the potential problem. So did I know for sure that we'd get to see 50 in a year? No, I wondered whether there might be barriers to treatment that might cause people not to show up. But did I also wonder whether we might end up with 500? Yes, I did worry about that as well. As it turns out, we started the assessments in November of last year, started treating in January of this year. yes, we've gone over the 50 that we were commissioned to do. We've had 72 young people joining us in terms of referrals. We had many, many more triages of people who are then not feeling quite ready to start or refusing to start, being referred by their families. But 72 were indeed proper referrals. And as well as these young people, we also had 29 parents who referred themselves because they felt they really couldn't cope anymore. So that's very important. These are separate treatment episodes for people whose children may not be ready or wishing to be part of treatment, or parents whose children are too young. Because I will tell you that 13 is the lowest I could get approval for to treat. But what I'm clear about is that there are 4 little children out there who are desperate to come and see us, and who haven't been able to, and they're waiting to be 13 to get treated. Now that we will need to, now I'm connected to this lovely group, there will be ways of looking after them. But as a new clinic, the most important thing is to be safe and to do things under a clinical governance that you're used to. And so for me, the most important thing is that I should work under the auspices of what has worked for all these years in behavioral addictions. We also, so the majority of people we've seen this year have been between the ages of 13 and 18. However, 22 of them were 19 to 25. So it's by no means something that only is problematic at a very young age. 5 people this year were over 25. One of them told me that he's a middle-aged man who stopped the car when he heard me speak on the radio, and he burst into tears because it was him that I was talking about. I didn't know this because I was referring to younger children, but he's got exactly the same symptoms as our teenage boys. So we must be aware that some people are indeed older and have carried this gaming with them for a very long time, and for some reason this behavior has persisted. Daria, I will just ask you to give me a 2-minute warning when I have to sort of wrap up, if it's okay. So at the moment we have at any one time we have roughly 35 people in treatment, and the hours that people are gaming can be anything between 12 and 18. That's roughly what we see. Now, during lockdown, one of the speakers earlier did mention this, we have seen a worsening because school gave structure. School absolutely stopped people from gaming in a very practical way, unless they stopped going to school, and we do have quite a few of those. So lockdown did worsen things. A third of our patients started gaming when they were 6 years old or younger. So that's something for us to look at in terms of research. How does that work in relation to potentially identifying vulnerabilities? The other thing to tell you about is self-neglect. Many of them were either very thin or really rather obese, very poor eating habits, unless they were lucky enough to have a parent who was preparing meals, often leaving them outside the bedroom door, as I know many of you will be familiar with this idea. Poor self-care was acknowledged by at least half of the children. So not showering, not brushing teeth, because of the preoccupation with the gaming. And very little exercise, often in people who were very, very sporty or competitive before the gaming took over. So just to summarize the types of things we've seen a lot of low self-esteem. I've got 2 minutes, so I'll quicken up. Social anxiety, low mood, poor regulation of boredom, and attachment issues. What functions is a gaming holding for these people? Well, a lot of escapism and avoidance of feelings, some reward and achievement, and a connection and communication and acceptance. Lots to say about that. I'll come back when we have longer opportunities to speak, but I'll just say that half of the children had turned violent sometimes very violent when things were taken away that stopped them from gaming. In some families, the police were called 20 or 30 times. We are underestimating the horrendous violence to others, to objects, to households that these children can exert, and also on themselves. One of my patients tried to strangle himself with his own hands. 2 tried to jump out of windows. These are very little children. So that's probably the biggest message to you. I had underestimated the terrible impact on family dynamics, on siblings, and on parents themselves. I've run out of time. As I said, I'll come back to you for a bigger talk another time. Thank you.
Thank you so much, Henrietta. It's so fascinating to hear about, the first year in the clinic. I've got about 1 million questions for you, but I shall not ask them now. We will have some time for questions after the next speaker. So thank you so much. And I am now really pleased to introduce our next speaker to you. And this is Professor Mark Griffiths from Nottingham Trent University. He is a distinguished professor of behavioral addictions, and he's the director of the International Gaming Research Unit at NTU, spent way over 30 years in the field, and is internationally known for the field into gaming, gambling, and also behavioral addictions more generally. He's published well over 1,000 refereed research papers, 6 books, 160 plus book chapters, and over 1,500 other articles. He's won 23 national and international awards for his excellent research work. And he also does a lot of freelance work. Journalism, has appeared on over 3,000 radio and television programs and written many articles for national and international newspapers and magazines. So I'm sure you will find him when you're looking for him on the internet. Today, he's going to be talking to us about technological addictions in adolescence. So Mark, the floor is all yours.
Thank you very much, Daria. Thank you for that introduction. As you probably realise by that introduction, I'm addicted to publishing papers, which is about the best addiction you can have in academia. Anyway, I'm going to, as Henrietta just kind of concentrated on her last year, I'm actually going to try and encapsulate my 33 years of research into 8 minutes. I started researching on gambling addiction in 1987. I moved into video game addiction in 1990, into internet addiction in 1995, and social media addiction in 2011. And the one thing I can say about that is that all of these areas have converged now. The good news, I think, for most parents out there that are listening, and maybe teachers as well that are in on this seminar, is that by my criteria, very few people are actually addicted to either social media, to gaming, to gambling. People accuse me of watering down the concept of addiction by applying it to behaviours. But in fact, if you look at the criteria that I've got, very few people would actually be classed as addicted to these forms of technology. So for instance, if I take gaming, which Henrietta has just been talking about, if you ask me, what does a gaming addict look like? Well, for me, a gaming addict would be someone where gaming is the single most important thing they do in their life. They do it to the neglect of everything else in their life. Even if they're not actually engaged in it, they're thinking about the next time they're going to do it. And so what we're talking about there is what we call salience and total preoccupation. We also, I would find, is that these people are using gaming as a way of modifying their mood, either to get buzzed up, high, excited, aroused, or to do the exact opposite, to tranquilize, to escape, to numb, to de-stress, to relax. Also, what you would see is these people build up the amount of time they spend on gaming over time. They may have started off spending 1 or 2 hours a day, and now they're spending 10, 12, 14 hours a day. I would also expect to see genuine withdrawal symptoms if they're genuinely addicted to gaming. So on a psychological level, these people will be more irritable, more moody, more frustrated, but also on a physiological level, I would expect to see genuine gaming addicts have things like nausea, stomach cramps, etc. The most important thing when I think it comes to addictions is that this activity completely conflicts with everything else in their life. They do it, it's not just they do it to neglect of everything else. They compromise their schoolwork, college work, university work, depending on what age they are. They compromise their relationships, and basically they don't have any other hobbies or any other interests apart from gaming itself. And the final thing I would expect to see, if you're genuinely addicted to gaming, if you have, if you've managed to give up gaming for 2 days, 2 weeks, 2 months, or even 2 years, is that when you start engaging those activities again, you go straight back into the cycles you're in before. And that I've just outlined 6 simple criteria there. And for me, people have to have all of those things present before you'd be classed as being addicted. And as I say, it's good news there is that actually most people would not be classed as addicted using those criteria. However, there are a lot of people that you would say are subclinical cases that engage in problematic forms of gambling or social media use. I think most parents might say to themselves, is that, my children, they spend 3 or 4 hours a day on the internet or playing games or on social media, and it's impacting on things like their education. Well, to me, that's not addiction, but it is something that could be seen as potentially problematic because it's taking children away from things that they should be doing. Now, I get emails every single week from parents saying, my typical emails are, my daughter's addicted to Instagram, TikTok, my son is addicted to League of Legends or World of Warcraft. And when I write back and I say to them, why do you think they're addicted? The number one answer that comes back from parents is they're spending too much time on this. They're spending 3 or 4 hours a day. And I have to write back to these parents and say to them, well, we psychologists, we've got a word for that, and it's called normal. And I think we have to realize now is that, what kids are doing today is that, spending 3 or 4 hours a day in front of screen-based technologies is pretty much what everybody does. Parents who don't do it themselves, there's this kind of technological generation gap. They also pathologize that behavior. And, my job is also, to try and assure parents is that, most of the time, I'm not saying for everybody, but most of the time, this is not going to cause big problems in that person's life. Another thing that comes through in my work, my research very particularly, is that we should never, ever confuse excess with addiction. There are, and again, the press always ask me, Mark, what's the difference between a healthy excessive enthusiasm and an addiction? For me, it's very, very simple. Healthy excessive enthusiasms add to life and addictions take away from it. And on that very simple criterion, very few people would actually be classed as being addicted to their activity. We also know from the research, I've published hundreds of papers over the last 33 years. One of the things that comes through very clearly, whether we're talking about gambling addictions, gaming addictions, social media addictions, is they have associations with other types of harm, whether it's anxiety, depression, loneliness, etc. One of the things I think comes through very clearly is that a lot of this is bi-directional. So when we see, for instance, an association between depression and various forms of childhood and adolescent addiction, what I would say is that obviously you've got some people who, if you like, are depressed before they start, and then they use things like gaming and social media and gambling to try and cope with that addiction. But we also get those people who may not have been depressed or anything wrong with them to start, but when they start engaging in long hours on those particular forms of technology, they then become depressed. So when I talk about these associations, I think a lot of them are bi-directional, and there isn't necessarily a very simple association with them. Another thing that I'm well known for, and this will surprise people, is that even though I was the very first person in the world back in 1996 to publish a paper on internet addiction, and although I've continued publishing in that area, I've actually gone on record in a number of my papers saying that the word internet addiction is actually a misnomer, in the sense that, as far as I'm concerned, when I talk about internet addiction, I'm really talking about people who have addictions on the internet rather than to the internet. So things like, when somebody is an online addicted gambler or an online addicted gamer, these people are not internet addicts. Okay, they've got addictions on the internet rather than to it. You may get a very small number of individuals who have what I would call a generalized internet addiction. They live out the whole of their life online and can't do anything apart from doing stuff online. You may be able to class them as a kind of a genuine internet addict. And then, of course, we've got things like social media. I mean, social media addiction, for instance, has no offline equivalent. If I'm a gamer, okay, and I'm addicted and the internet goes down, I can go on my console. If I'm a gambler and internet gambling addict and I can't access the internet, what can I do? I can go to a betting shop or I can go to a casino. With social media addiction, if you're addicted to social media, and the internet goes down, you don't suddenly walk into a great big room and start talking to everybody. So you could argue that things like that are a genuine internet addiction. A few things I'll say, this is real potpourri. What I'm trying to do is put a few things out in terms of my own research. Okay, if I take all the stuff that I've done on particularly social media addiction, gambling addiction and gaming addiction, our research has tended to show that between about 1% and 4% of children and adolescents appear to have problematic behavior concerned with those activities. And the other thing I would say is that there are so many different screens that we use to kind of assess these behaviors. None of those, particularly in terms of a kind of epidemiological survey, we can't diagnose people when we use these screens. And at best, when we're doing this research, and for instance, I did one of the co-authored one of the very few nationally representative studies on social media addiction. Okay, so this is with a nationally representative study of over 6,000 adolescents, and we reported that 4% of that sample were at risk of being addicted to social media. Of course, the press turns that into 4% of kids are addicted to social media. In fact, that's not what the paper says. It's saying using the screening instrument we used is that 4% of these people might be at risk of social media addiction. And if you ask me, you know, do I think that there are 4% of children that are addicted to social media? The answer is absolutely no. Okay, I mean, if 4% of children were addicted to things like gaming or gambling and social media, what I would expect to see is clinics like Henrietta's in every single major city up and down the country, and that's not what we've got. That's obviously, Henrietta briefly mentioned there are barriers to treatment in the first place, and we do know that children and adolescents are less likely to turn up for treatment. But you know, I would still expect, if this was a really major problem, I would expect to see those treatment clinics in every major city if the level was as high as 2, 3, 4%, because that does equate to tens of thousands of children. Final thing I'll just end by saying is that, again, you know, when we talk about addiction, I mean, I've been talking as if all the problem is located within the individual, okay, and it's absolutely not. I mean, when people talk about individual characteristics, they're talking about people with biological or genetic predispositions. They're talking about people with emotional, psychological predispositions. Most of my research has actually looked outside of the individual. You know, what is it in the environment and what is it in the products themselves that make these things potentially problematic and addictive for a small minority? So I always think of any addictions in terms of these three kind of global components: the individual characteristics, the situational characteristics, and the structural characteristics. And when we talk about things like gambling, gaming, and social media, there are, you know, when it comes to things like problematic behavior and addiction, the structural characteristics of the activity itself can be very important in terms of determining whether people have problems with these. So things like, you know, the like button in social media, or the event frequency of something in gambling, these are really, really important in determining whether somebody might develop a problem with something. So, for instance, I could create you the single most addictive lottery product, and, you know, lottery gambling is seen as one of the safest forms of gambling that have very few in terms of problem behaviour. But instead of having, you know, instead of having the draw on a Wednesday night and a Saturday night, if I made the draw every single minute, I could actually create, you know, basically a much bigger proportion of people who have problems with lotteries by just changing that simple structural characteristic. I could also create you the safest slot machine in the world. Instead of, you know, if kids came up to play on my slot machine, I only let them press the button once on a Wednesday night and once on a Saturday night. I can guarantee no one will ever become addicted to my particular slot machine. But then, of course, and the final thing I'll say is that, you know, when it comes to addiction, there are stakeholders, and it isn't just about the people who play and use these activities. It's not just about the academics and treatment service providers. Is that obviously the industries themselves have to take responsibility for the fact that they've got products that small, you know, it's a consumptive product that for a small minority, people do end up engaging in problematic and gambling behavior. So things like advertising, marketing, where you distribute your products, these are all really, really important questions. And even if the social media operators and the gaming operators think that the problem relies in the individual, if you've got a product that is consumptive and you know a small proportion of your clientele end up having problems for it, you have to take responsibility for it. And, you know, the great thing about technology, and I'm a great advocate of technology, I love technology, obviously technology, as Sonia was saying right at the start, is something that's absolutely vital now. We can now start to harness this technology to actually help treat and help those people that unfortunately do suffer from problematic or addictive problems. You know, the great thing that, you know, when I think of all the research that I've done, the most exciting research I'm doing now is when I've got actual behavioural data from actual people themselves. We can actually start to see, you know, every click stroke that somebody is doing online. And when we start to look at that, we can start to use algorithms. We can start to intervene and prevent from people getting problems in the first place. So I'll leave it there. Sorry that I rushed through it. Hopefully I've summarised 3 decades of research in a very small amount of time, and I look forward to any questions.
Thank you very much, Mark. Thank you very much for the summary, which of course had lots of content as well. Thank you also to Henrietta. Now we do not have a lot of time, and before I turn to the questions of the audience, I would like to take the moderator's privilege in asking the first question, if that's okay with everybody. And that question I would direct to Henrietta in the first place. Now, given your experience now with the National Gaming Disorder Clinic, could you tell us a little bit about the process that you're using in terms of classifying and diagnosing the individuals who come to see you?
We, although we do use a screening tool, actually that is really secondary, because what we're trying to do is to stay open-minded. I really support what Mark says in relation to the fact that it is highly unlikely that we are going to end up, flooded with people. And so the idea what we are trying to do is we are trying to receive anyone who is struggling with the gaming, or anyone whose families feel they are struggling with gaming, and seeing and giving them the opportunity. Now, as it happens, they are all scoring for caseness on the screening tools that diagnose, if you want, a gaming disorder. But to be honest, if someone was having a terrible time and not going to school because they wanted to game, even if they were not scoring enough to be considered suffering from gaming disorder, we would still see them, because what I learned from setting up the gambling disorder clinic all those years ago is that people's struggles are often idiosyncratic to themselves and their own environments and situations. And so in the first or second year of a national clinic, you need to see what comes through rather than use forms that have been validated internationally. I was interested in understanding what types of games people were doing, the hours, the complications, and this violence issue is really severe. And sometimes it comes from students who actually at school are doing very well, are excelling at school, but they're very violent at home when the gaming platform's taken away. If it's kept there, then they don't have that many problems, interesting. But if you remove it, it all happens. And the parents feel that 15 hours a day is too many, which I would agree it is. So we're looking at the different permutations. And so more on that in the future. But I don't think you need to be scoring on criteria made up, globally in order to have a problem. And I think that's important. I don't want to put people off referring themselves.
Thank you so much. I think this is really, really helpful. And I'm so curious to see the first results, that are coming out of your research with your clients. They're actually coming out so we can read them and have more discussions about them. Thank you so much. Now, I'm going to move to Mark and ask Mark a question that's coming from the audience. And I'm afraid this is probably the one and only question that I can ask given our timing. Now, how shall we address this intractable problem intersecting mental health and digital technologies? Which is the head, which is the tail? Is the head social practices and human behaviors, including how people interpret content they're exposed to, or technologies, or both?
Very simply, the answer is both. The thing with any of these issues, there are just so many pathways into behaviour that's healthy, behaviour that's unhealthy. And you always have to look at this from a kind of 360-degree angle. And I know, that's why I always say that addiction is really complex. Okay, and it's why I'll have a job for life. If things were nice and simple, I could give up tomorrow and we could all go on to look at something else. And there's all, I think in the addictions world, there's just always something new as well. And technology, I remember writing, I wrote a paper simply called Technological Addictions back in 1995. And even though it wasn't a very good journal, it's actually become now one of my most highly cited papers, mainly because it was the first paper that kind of tried to bring this all together. And one of the arguments I was trying to make there is that, if you like, the kind of that technology is something that if you are vulnerable or susceptible, can actually facilitate problematic behavior. And of course, whereas historically becoming addicted to something or having problems with something was related to situational characteristics like accessibility or affordability, now of course when we talk about things like social media or gambling or gaming, anyone with a smartphone is walking around with a bookmakers in their back pocket, they're walking around with the leading social media operators in their back pocket. 30 years ago, if I wanted to gamble, okay, and I was an addicted gambler, I basically, unless you did it illegally, you couldn't do it for more than about 10 hours a day, because that's how long the betting shop was open or the casino was open. Now, of course, the internet, what that does bring, and what that technology affords, is 24/7 accessibility, 365 days a year. And if you are that, if you have got those predispositions or vulnerable or susceptible, then that is obviously something that's going to play into that.
Excellent. Thank you. Thank you so much. There are more questions. I have more questions. The audience has more questions, but unfortunately, I will have to now pass on given the timing. Thank you both so much. And I'm going to pass on to Elena.
Thank you, Daria. And thank you, Mark and Henrietta. I've learned so much. Very insightful contribution. Now, closing the event, I have two more speakers, last but not least. I'd like to invite Gordon Harold, Professor of the Psychology of Education and Mental Health at Cambridge University, and eNurture Director. It's my great pleasure to hand over to you, Gordon.
Thank you, Elena, and thank you, Richard, and other colleagues who organised today's event, and thank you everybody on the participant list, 200 plus people attending today. Very busy schedule, so thank you to all for putting the time aside to attend today's event. Thank you to all the speakers and panelists, very interesting perspectives across the board. A little bit about me. I'm one of the categories Sonia mentioned earlier. Sonia is Deputy Director of what's called the Nurture Network, or eNurture. I'm in the category that Sonia mentioned of not knowing much about the digital world and quite a bit about the mental health world. So it's from that perspective that I offer contributions to today's event. So as Elena mentioned, I'm Director of one of 8 mental health UKRI, United Kingdom Research Innovation Mental Health Research Networks. The network that myself and Sonia and others lead very specifically focuses on the digital world, but actually asks the question as to how we better understand how the digital world infuses everyday families, school, and peer relationship influences in relation to child and adolescent mental health. And I'll tell the story, if you like, as to the origins of the Nurture Network towards the end of this little brief summary. I want to talk a little bit about what the network is, first of all. So these mental health networks, 8 mental health networks, are not set up as standalone research projects where academic researchers or clinicians like myself have a question, go off and gather data, and then come off with a set of recommendations. Actually, they are panels of so-called academic experts and other professional advisors and young people themselves, as well as parents, teachers, and other contributors, that allow us to frame and ask questions with respect to commissioning research and commissioning practice engagement, etc. So I would invite those interested to go onto the eNurture or Nurture Network website. You'll find links to the other 7 networks, and each of the networks are there to commission and support research that you or colleagues consistent with the requirements of the networks might be interested in asking. The core objective of the network is to stimulate new knowledge, and new knowledge very specifically around child and adolescent mental health in later life, and factors that influence mental health. I'm going to come back to the point about mental health again in a moment. Bernadka at the start of the presentation summarized, if you like, the state of the nation, UK, in relation to child and adolescent mental health. And the statistic that was 1 in 10 went to 1 in 9, went to 1 in 8, is now 1 in 6 children and adolescents up to age 18 years report or experience a serious mental health problem. I was interested in the summary of topic areas linked to what would you change about the digital world after the first set of presentations, and it was just noticeable the term mental health didn't appear anywhere. So I think it's a really interesting question when we talk about digital world and technology and mental health, but actually nobody in this audience flagged mental health. A report this year, the Good Childhood Report in 2020, which looks at mental health and well-being, concluded that among 24 countries reviewed, UK adolescents between the age of 10 and 15 years were doing least well in multiple domains of well-being and mental health. Important to put those two together, not entirely the same thing. But of 24 countries, UK adolescents doing least well, and multiple factors reviewed as to what might serve as correlates to poor well-being for that age group. Most strikingly in that report, increased digital use was not one of the factors. Poverty, changes in education experience, multiple factors well documented by way of linking to mental health still stand out. So it's interesting to talk about links between digital world and mental health. As Sonia has written about very persuasively, actually the evidence is very underdeveloped in establishing not only associations, but certainly causes when it comes to digital sourced influences on child and adolescent mental health. However, there's absolutely no question that the digital world is a substantive influence on children's development. So if I tell a little story about where eNurture came from, and then with Sonia and colleagues, it was converted into a research proposal. It was actually in a conversation with a young person aged 12. It was in a very difficult challenge circumstance. And in conversation with a social worker, the social worker expressed concerns about the amount of time the young person was on their mobile phone. And this was a conversation topic. and I was part of the conversation. And when the social worker left, in just kind of casual conversation, the young person volunteered and said, actually, nobody had asked me why I'm on my mobile phone. Everyone assumes that I'm on my mobile phone for negative reasons, or I'm playing on, I might be gaming, for example, or I'm just engaged in activity on the mobile phone. And the short version of the story was the young person actually engaged with his father through WhatsApp, and identified in conversation that his father suffered from bipolar disorder, and regular contact with his father allowed him to feel connected, and that the relationship with his father was sustained and positive. And if the mobile phone was taken away from him, he would kill himself. And hence the need or the reason for being in this particular care setting. And it struck me as a so-called mental health expert or specialist that was the last thing I expected the young person to say to me. So I want to point out two things that must be absolutely central to moving forward. One, that was the voice of a young person informing the experts as to actually the engagement and utility of a digital world resource. Second, it was positive. I've got no question that young person was very serious in their declaration of next steps. Third, it spoke to a fundamental area that I'm supposed to be a particular expert in, which is family relationships and child and adolescent mental health. And it was striking that actually this was now a resource that allowed the relationship to exist without it just being interpersonal. And I came away from the meeting and picked up a good old-fashioned developmental textbook, and the phrase eNurture and nurture network. If you look up nurture in the classic nature versus nurture debate, and you look up nurture, family, peer, school, you will not find digital. But actually family, peer, school are now entirely infused with digital influences. And that's where Sonia and others came into play in conversation. And actually we can't look at the nurture and socialization experiences that young people have without considering digital. The question is, what role does the digital world play directly and indirectly with respect to child and adolescent mental health outcomes? And in the conversation earlier, again, I think Richard asked the question about digital literacy and the digital literacy of particular professional groups working with young people. A tough question is, what is the mental health literacy of professional groupings working with young people? What is the mental health literacy in terms of training of parents, of teachers, of other practitioners to understand typical development? What is typical or normal, to use the phrase that Mark just used a second ago? And what is atypical? What is a possible problem, a deviation from what we expect? And without understanding that part of the association, we can't really begin to look at the starting place that digital world is inevitably linked to poor outcomes. So we need both. So if there was one thing I could change around the digital world debate, etc., is that actually the opportunity for learning both with respect to digital literacy and mental health literacy, if we are to understand that association, is a huge opportunity. The digital world will not go away, but it's only when we can come up with guidance and knowledge that helps parents directly, professionals directly, and young people themselves directly, will we advance this whole debate, question, opportunity. I invite you to go to eNurture, more information there. Again, Elena, thank you, and Richard and colleagues for a fantastic event.
Thank you, Gordon. Thank you. Thank you for sharing some positive insights here as well. Richard, over to you. I know that you are part of my list of closing the event.
Yeah, no, thanks. And thanks, Gordon. I didn't think you were going to say that. I thought you were going to talk about digital poverty and those that don't have the luxury of devices and connections. But actually that challenge for us all to be, even at this stage, improving our mental health literacy. This is not what I was going to say, Elena, but last year we did some research in London where young people about their own mental health absolutely wanted their parents to feel more understanding. Many of them would be given, particularly migrant groups, you know, sort of very confused messages about if it's not visible, it can't hurt. So absolutely those conversations, much work to be done, and colleagues at Thrive London are working very hard on that. I was just going to share a few slides, Elena. Actually, is it worth it? No. I just wanted to conclude by saying I think this is a great, I think, landmark event for UKIS and DCMS. Sonia and Julia Davidson will remember that my first contact with the evidence group was almost 9 years ago. And I think that meeting was at CEOP, which in simple terms was like a police station, I guess. And I think in the development of the digital world, that influence of the criminal justice perspective has made it difficult to see some of the things that have been addressed today. And so this feels to me a fantastic opportunity for us to be broadening out our understanding of where harms may occur. And I think Bernadka gave a great account of a balanced account of where those might lie, but also those questions of what it means to live well in that way that Gordon describes, where the digital world is intersecting with almost all aspects of your life and relationships, your education, your work, and so on. So I think this is great that we're actually starting to talk about it together, and I think we're all learning from each other and all taking risks in terms of acknowledging what we don't know, let alone how we ask the young people who may be more knowledgeable in certain areas, but of course are still learning themselves. And I think somebody at some point mentioned rate of change. I think it was in the word cloud, Elena. But when it came to thinking about what I would change, I was asked this question, hence it came to here, following a conversation with the team at Super Awesome, who, in terms of when we think even about industry, there are lots of companies ready to open their doors and have conversations. And they asked me that. And I was first of all thinking about likes and shares and followers and all those sort of metrics that can get colored with self-esteem issues. But actually what I'd found, and I've been saying this for a while now, is the monetization of activities online, particularly for influencers and creators and perhaps the sports stars now, what I was hearing in the consulting room were actually very present in their lives. And yet what we don't have is the performance regulations that DFE developed for child actors, and I think child sports stars as well. So young children as young as 3 or 4 years old are kind of influencers, like Toys and Little Gabby, I think, is one of the most successful UK ones, without us having a framework. And so why does that matter? It may be an escape from poverty for some families. Well, that led us down to the road, and Super Awesome were very preoccupied with children, very young children, taking very political arguments into their online spaces. And where was play anymore? And so I looked back at some of the research on play, particularly from the US in the last sort of previous decade, where there was already, in terms of educational attainment, which again can be a way out of disadvantage and a way of reducing inequalities, the opportunities for play were being reduced quantitatively, and similarly in terms of unstructured time for older adolescents, similarly sort of eaten away by a target-driven world, really. So that's why I would question monetization, for particularly in relation to the activities of children online, and that would be my sort of area that I would want to focus on, because yeah, there's a sort of risk, isn't there, of stealth labor really for the children of our day that you know, needs to be also recognized. So just when it was getting really simple after all these fantastic presentations, here's something else to add to the Christmas list for DCMS. No pressure, Rachel. Thank you.
Thank you. Well, that leads me to really make a few announcements, which this is one of the first of the 3 webinars that we are organizing. We have another one coming up in February. That's going to be on online abuse, and we'll have policies and government involved as well. And then we'll have another one in April on adult and online harms. That it's also a very hot topic at the moment, given also the pandemic and how much time adults also have spent online. We have still Slido running, so I'd be very interested to hear what you think about that question. If there's one thing that you would like to change, what would that be? And I'd be fascinated to see how our speakers have influenced your answers. So please feel free to continue to share your answers. Now, a lot of questions here around, you know, are the slides going to be available? Is the recording going to be available? Yes, we're going to share that. We've been tweeting. We're going to be writing a blog as well, which we'll be sharing. So lots of information and material. This is not the end of the event, but the beginning, I would say, of the conversation. So all I have left really to do is to thank you all for the array of expertise, for making this happen, the DCMS, eNurture, the UKIS Evidence Group, Middlesex University for their support as well. And of course, all to the speakers as well for taking time. I hope you found it valuable. And I'll be sharing details about our next webinars very soon. So I'll keep your emails and I keep tweeting and I keep sharing all this wonderful information. Thank you all. And I guess this is it. I wish we could all go for a drink, but it's not going to happen. Thank you and I'll see you soon. I'd be happy to be one of the last to leave. I'm going to stop recording. Thank you.